Vitamin K is a group of fat-soluble vitamins that play a crucial role in blood clotting, bone health, and other important bodily functions. There are two primary forms of vitamin K, vitamin K1, phylloquinone, and vitamin K2, menaquinone. Vitamin K1, phylloquinone. This form is primarily found in green leafy vegetables like spinach, kale, and broccoli. When we consume foods containing vitamin K1, our bodies convert it into an active form called vitamin K2. Vitamin K2, menaquinone. This form is synthesized by bacteria in the intestines and is also present in some animal-based foods. Vitamin K2 comes in several subtypes, the most common being MK4 and MK7. Fermented foods like natto and cheese are good sources of vitamin K2. The main role of vitamin K is to activate certain proteins in the body that are essential for blood clotting. It assists in the production of blood clotting factors, which are crucial for wound healing and preventing excessive bleeding. Additionally, vitamin K plays a vital role in maintaining bone health by regulating calcium metabolism and supporting bone mineralization. Vitamin K deficiency is relatively rare but can occur in newborns. Individuals with malabsorption issues, or those taking certain medications that interfere with its absorption. Symptoms of deficiency include excessive bleeding, easy bruising, and impaired bone health. It's important to note that if you are on anticoagulant medication, such as warfarin, you should consult your healthcare provider before making any significant changes to your vitamin K intake, as vitamin K can affect the effectiveness of these medications.